So what is fat grafting and how do I use it in my practice? Well, fat grafting is as it sounds. Fat is grafted into certain areas where they'll be useful. So initially the fat is harvested through a technique much similar to liposuction, but more gentle liposuction I call it, from anywhere in the body that you may have fat that you want to lose. Now this fat is spun down, cleaned and prepared so that it's ready for injecting into the recipient sites wherever we need it. Now in my practice, the surgeries that I use fat grafting in, I use it as an adjunct to my breast lift with augmentation or breast augmentation surgeries. Also in my lower eyelid surgery and my facelift surgeries. Now there's certain pros and cons of using fat grafting. Now obviously with your own fat cells, it's organically compatible to your own soft tissue. So when the fat is viable or survives in a certain area, it's there long term. So you don't have to replenish the volume as compared to, for example, having fillers on your cheeks, where most of the products that's used nowadays is hyaluronic acid substitute, and these hyaluronic acid can get metabolized, and every few years or after a certain time period, you have to replenish the volume. Now the cons is because these are cells that's actually been harvested from somewhere else, it's need to survive in the recipient site, so it's need to develop a blood supply. Unfortunately, not every single one of these cells survive, and it's variable. This number is variable, but under the best hands, the author that described this technique, he says in the literature about 40 to 55% or up to 60% fat survival rate. Some better, some probably a bit less. Also, after the fat grafting, it may be a part of the stem cell reaction, you get a lot of swelling, a lot of bruising. So preparing yourself for post-fat grafting period is very, very important to have a time to yourself, a bit of period to recover for yourself.